A short information about Switzerland's support in Moldova mental health development. Starting with 2013, it was started a big support from SDC, from Switzerland, to health sector, in particular in developing of mental health services. And for such, it was launched a project in 2014. We call it MENSANA. It's an abbreviation, but the long term of the project is supporting of mental health care development in Moldova. And this project mostly has been oriented to developing a community-based model of mental health services. So implementing agency, it's a Trimbus Institute of Mental Health and Addiction from Netherlands. And so far, there are two phases. First phase of the project started in 2014 until 2018. And it was succeeded by second phase, which now it's ongoing. And we are looking in future to continue with the next final third phase. So overall goal of the project is that people with mental health issue in Moldova receive care appropriate to their needs and reach their recovering goals. It's very ambitious, it's very huge, it's very big overall goal. And for such, each phase has been defined several objectives. For instance, for the second phase, we have two outcomes, two key objectives. One is the countrywide network of mental health services providers ensures equitable access to quality and affordable care responsive for the user needs. And at the same time, so this is on supply side, and on demand side, that people across Moldova are more aware of the importance of their own and other mental health, more willing to access mental health services, and if it's necessary, and support the social inclusion and recovering of the people with mental health issues. So to understand how COVID pandemic impact mental health, a few issues, so few results which has been achieved before pandemic started in Moldova. So at the end of 2019, a favorable policy environment and legislative framework for mental health services reform was created, and mental health care pathway was in place, so which means community mental health centers, primary health care, and specialized inpatient care. And the network of community mental health centers was set up countrywide. And at the end of 2019, 89% of all registered people with mental health needs have been assisted. Unfortunately, since COVID pandemic hit Moldova, and the first cases happened in March 2020, so far we have overloaded hospitals with increased number of COVID patients, and many are in critical conditions. It was higher infection rate among health workers, and also together with burnout, this led to increasing shortage of healthcare personnel. And many health conditions other COVID didn't get necessary attention because the system looked mostly to tackle the problem related to infection. And of course, people with chronic conditions, in particular with mental health, long-standing situation, they didn't have enough access to services, and along with fear to getting infected in healthcare facilities, this discouraged people to have healthcare seeking behavior. mental health services also has been impacted by COVID, and in particular, this was related to people's mental health condition. So it was observed increasing risk of anxieties, burnout, depression, etc. And at the same time, access to healthcare, to basic healthcare services, and users' accessibility to services, as well as outreach actions targeting vulnerable and excluded groups, also has been impacted negatively by COVID. In particular, user visits to mental health, community mental health centers dropped by 25%, while the number of home visits by specialists of community centers decreased by 70% in 2020 compared with 2019. So here you can see several figures. So in boxes, it's visualized how the number of people using mental health services at the community level decreased in 2020 versus 2019. And you can see a slight changes also in the gender dimension and urban rural. And also the prevalence and incidence has very interesting dynamics. The incidence increased, so this means additional new acute mental health episode has been registered in 2020 when pandemic already started, while prevalence slightly decreased, which means that some of people dropped from the observation due to, as I mentioned before, some restrictions and decreasing in using of the services. It also, pandemic had some negative impact on domestic violence. So here it's data which has been collected by one NGO which is specialized in women violence, and in 2020 compared with 2019, it was observed a decrease, increasing of domestic violence by 2.4%, and more than 90% of all registered domestic violence victims were women, which means that the pandemic unfortunately impacted very high the women, the violence, and together with other negative impact on mental health should be addressed much more consistently. The project supported also Moldovan authorities to analyze how pandemic impacted also the status of the mental health status of health professionals, medical professionals. And you can see that according to one assessment which has been organized among 195 cases, so health professionals from different areas. So it was defined that anxiety is in 62% of cases. Sign of depression was registered in almost 60%. Athenia, fatigue, 52%. Burnout in 44.6%, and sleeping disorder in 40%. What it's important to mention that 79% of all cases were women, and only 21% were men who was looking for mental health support. The burnout syndrome also has been assessed by the project, and among 137 health professionals, 119 were from emergency services, and in the same time it was mentioned that 89% of all respondents have different level of burnout. So the low level in 55%, the medium 31%, and high level in 40%. All this data demonstrated the huge impact of COVID, of pandemic, of general situation on mental health status, either general population and on health professionals. So in such condition, the mental health service project started to pay much more attention to tackle the problem. And here several measures which have been taken. So the first national clinical protocols have been adjusted, and an additional chapter related to mental health of patients with COVID have been introduced and used in the practice. Also, it was organized instruction on intervention on mental health in Moldova context of COVID-19 development. In particular, responsibilities, level of intervention, general recommendations which should be followed by population and health professionals. Intervention algorithm for general population, for medical workers, for pharmacists and at community level, and for team leaders and the managers has been developed and spread out. Methodological instruction for psychological counseling in stress reduction for general population and in burnout for medical workers, and guidelines for medical professionals on intervention in COVID-19, how to help families, children, adults with special needs in a public health crisis. So all these things have been developed, have been taken and used in intervention supported by SDC in Moldova. Important focus was aimed on prepare the health professionals to tackle the problem. For instance, how to react and how to provide the first psychological aid. And this has been organized through trainings, and for all professionals, for all staff members of community mental health centers, for psychologists from the hospital, both psychiatric and general hospitals, and for all specialists of residential institutions and prison. So in other words, entirely all staff which directly or indirectly are involved in the mental health issue has been trained how to act in such condition. And also the mental health staff have been permanently instructed, and webinars with different topics related to mental health issues in pandemic situation had been provided, and you can see here several elements of such capacity building process. In the same time, a part of problems, obstacles, constraints generated by pandemic, it was observed that it's a huge opportunities which could be used to increase the role and, more important, to increase the perception and understanding of mental health and other things in the context of COVID constraints and crisis. For instance, more emphasis on mental health issues and its importance was possible in comparison with previous period. It was registered more proactive synergy between different stakeholders. So more intersectoral cooperation has been observed, more openness to support and to participate in different common activities where mental health also plays an important role. Better collaboration between inpatient and outpatient services. If previously it was some reluctancy from the psychiatric hospital in relations to new models of community-based mental health services, during the COVID process or period, it was observed more openness and better collaboration. And what it's very nice opportunity is that community mental health centers started to play much more important promotional role among general population and among health professionals. And of course, better collaboration between community mental health centers and primary health care in the mental health patients monitoring. So all such opportunities, of course, have been explored and used, and will be continue to be used to increase the role of mental health issue in all policy, in all interventions, and in all activities where the health sector is involved. So we defined several lessons learned, which are based on some evidences, on observation, on cases which have been also analyzed. So one of the important lessons defined by the project and by us is that health professionals usually do not ask psycho-emotional support. And it's a strange statement, because vice versa, we expect that the health professionals should be much more aware about such things. But we understood that it's some less knowledge about some peculiarities of mental health situations or status or conditions. And also it was a high level of double stigma, so related to COVID, so fear to not be infected by COVID, and also stigma related generally to mental health issues and people with mental health problems. Another lesson learned is adequate and timely information of health professionals in mental health topics, in particular in acute stress disorder, in PTSD, in adjustment disorders, in somatization, and others represent an effective prevention measure. So the project and the intervention done in COVID period showed of such important things. And also it was mentioned that intersector collaboration, it's very important, and in particular during the COVID period, the different sectors, as I mentioned before, presented more willingness to collaborate, much more openness to take and to participate in different common actions, in common intervention at the community level and also national-wide. People quickly adjust to changes. So since intervention started to use mostly different distant learning process, webinar, online, web-based intervention, and training and meetings. So this showed that generally people and professionals adjust very quickly to new conditions and are open to, and such things is a very good opportunity for further exploration and using in better communication about different issues related to mental health. And web meetings and online training strengthen
the participation and partnership. This briefly was what I intend to present, but more information which everybody who is interested to get and to understand in details what the project is doing, what results it's done, you can find on one link which is posted here. Thanks for your attention and interest.